Okay, good evening, everyone, and welcome to ATP Live Monday. How has your day been? Hope you've had a lovely day. So, welcome. Thank you so much for joining me on whichever platform you are watching on this evening. Um, First and foremost, let's just share the video first so that everybody can see us and they can hear us. I want to encourage you to do the same as well. I'm just going to do the same. Welcome everyone, wherever you're joining from. I'm doing my Jackson for you guys. That is the matter. Oh, apologies for that. Let's just share the video. Let's welcome everyone. Um, I'm just going to do the same as well. Okay. Instagram. I think my Instagram was also on. Okay, that's why. Okay. All right. Thank you so much, everyone, for joining us. And this is Ask the Pediatrician Live. If you have any questions about the health of your children, this is the time for you to ask your questions. You start by putting the age of the child and then a little brief summary of your concerns about the child and your questions, and then we'll try and answer them. So thank you so much for joining me. Just again, just share a little bit of the video. Okay, I think just let me know if you can hear me on Instagram and on Facebook. Just let me know. Um, okay, all right. I'm just going to share the video again. Let me just share to all our groups. Welcome everyone. Okay, let me also pin it to the video. I'm live, okay? Okay. So welcome everyone. Bear with me. I'm just trying to share the videos platforms and just to make sure everybody can see it. And then I'm just going to pin the video. Okay, and then pin to another video. Okay. Okay, I'll pin this one. I think I need to pin in Ask the Pediatrician. Okay. Okay, so thank you so much for joining me. If you are there, let me just know you're there. Feel free to share your comments. Thank you, and welcome. Just one more sharing, then I will be ready to start. Just to share again. Okay, okay. I share to my stories. Okay, I think I'm done with all the sharing now. All right, good evening, everyone, and welcome to ATP Pediatricians Live Monday, ATP Live Monday. I am Bimi Salaboide, and it's my pleasure to be here this evening. This program is brought to you by ATP Pediatricians Foundation. ATP Pediatricians Foundation is committed to the health and to the welfare of all children globally, also especially in sub-Saharan Africa, where a lot of our children die from preventable causes. So, and we do that through our online platform and our offline community medical outreaches. So, thank you so much for joining us. So, ATP Life Monday is just one of our programs where you get to ask any questions that you may have about the health of your children life, and you will get immediate answers. And also it's also another opportunity for us to teach and to talk about important topics that has to do with the health of our children. So thank you, whether you're watching on Instagram. Thank you so much for Simoye, Simple Sense, Nana Sigis. Thank you so much, Smart and Fabulous. Thank you so much for joining. And for those on Facebook, also thank you so much for joining us. So if you have any question you would like to ask about the health of your children, drop the questions. Start with the age of the child and your question, and I will try and answer them. We just have 1 hour for this live session. But remember that if you still have any questions about the health of your children after the live session, you can actually uh, go to our Facebook groups, Ask the Pediatrician Facebook group. You can drop your questions there and we will also answer them. Just give us up to 2 hours. Sometimes we answer a question within 24 hours, but at least max 2 hours we will answer your questions. And of course, we recommend that if the children are very sick, that you actually take them to the hospital rather than just post and leave on the Facebook group. Sick children should be taken to the hospital. But if you want to learn about health issues, what do you do in certain situation, you can always just drop your questions and then we'll try and answer them. If you're watching on our page, you can just drop your questions directly under the page, under the video, and I will answer them. If you're watching on Instagram or YouTube as well, you can just drop your questions directly under the video and I'll be able to see it and I'll be able to answer it. However, if you're watching on um, our Facebook groups or any of the other groups where our video is allowed to be shared, you definitely have to click on the video itself so that you can drop your comments directly under the video for us to be able to see it. Otherwise, I won't be able to see the question. So if you drop the question in the group, I may not be able to say it. But if you drop the question directly under the video, I will see. But if you're watching on the page or watching on Instagram or YouTube, we can definitely see your question and we'll be able to answer them. So thank you so much, everyone, for joining me today. I can see a lot of you on Instagram. I'm still trying to see people from Facebook. So the floor is open for you to ask your question. Today is the last Monday of June, and July is our ACP month. We celebrate throughout the whole month of July, but the last week of July will be our ATP week, and because ATP was created in 2025, so next month will be 11 years of having to be online, supporting parents, supporting families in raising healthy children. We're thankful, we're grateful for everybody who has been part of that journey, all our volunteers. So watch out for our ACP week celebration. It's always going to be amazing. But today I'm here to answer any question that you may have about the health of your children over the next 50 minutes or so remaining. So feel free to drop your questions. I'm just going to check. I don't have any questions yet, so I'll wait for you to drop your questions. So while we're waiting to drop questions, I'm going to talk a little bit today about stools, because I get a lot of questions about stools in children, and a lot of mothers worry so much about, oh, how many times the child is passing stools and things like that, and they always want to know whether it's normal or abnormal. And it depends also on the age of the child. And then another thing is whether there is texture. So there's issue about frequency, there's issue about texture, whether it's too hard or it's too watery or what is normal. So while I'm waiting for your question, I'll start giving some tips about that. I just want to say that if you're ever going to ask us any questions around your bowel motions of your children, or the poo, or the stools, depending on which one you are comfortable with, let's just stay with poo. If you're going to ask any question to a pediatrician about poo, the first thing we want to know is what the child is feeding on, okay? Because obviously, what the child is feeding on is what is going to determine what the what we are going to uh, what we are going to expect in terms of bowel motion, because we know that the intestinal tract is one long tube, it's the longest tube in the body, and it has the opening, which is the mouth, and then the exit, which is the anus. So it's just one long continuous tube. So whatever is coming out, it depends on what goes in from the entry point, and that will determine what goes out at the exit point. So a lot of time, parents has questions about the stools of their children, and the first thing we want to know as pediatricians is that what are you feeding your baby? So anytime you want to ask us this question, please start with my baby. If your baby is between 0 to 6 months, we expect your baby to be on exclusive breastfeeding. So always let us know I'm doing exclusive breastfeeding. And if you're not doing exclusive breastfeeding, tell us I'm using formula, or these are the things that my baby is eating. And for the other older children, if you're still breastfeeding and you're giving semi-solid, always let us know. So it's always good to let us know what you're feeding your baby when you are asking question, because what goes in determines what will come out. So that's the very first thing I would like to say about the issue of stools. Then the second thing I would like to say is the frequency. We get a lot of questions about frequency. My baby is passing stool once a day, 2 times a day, 4 times a day, 20 times a day. When should I be worried? Okay. Again, that varies. It's actually a question that varies widely in terms of how often should baby pass through. You know, for our young babies, for our newborns till like 6 months, babies on exclusive breastfeeding, actually, they can pass through up to 12 times a day. In fact, they can pass through every time you feed them. And so, a lot of mothers will say, oh, my baby's passed through 2 times, oh, 5 times, and I'm worried. No. Actually, the number of times your child passed through is not as important as the texture of the stool that is passed. It is actually the texture of the stool that is passed that will help us to determine whether that frequency is a lot or not. So if a child is in normal stools, the child is passing normal stool. I have a stool um chart. We call it Bristol stool chart. I will try and show it at some point. If your child is passing normal stool, um it's not showing. Okay. Okay, yeah, it's showing now. If your child is passing normal stool, if you're able to see my stool chart, that is type 4 stool. If your child is passing normal stool, which is type 4 stool, It doesn't matter whether your child is passing that stool 10 times a day, 20 times a day, and all that. As long as the stool itself is normal, we are not worried so much about the frequency. Okay. As long as the stool texture is normal. So the stool texture, we have type 1, type 2, type 3, type 4, type 5, type 6, type 7. So whenever you're asking us question about stool, in addition to telling us whether what your child is feeding on, the next thing we want to know is what is the texture of the stool. Or if you have access to the stool charts, you can actually tell us it's a type 1 stool, it's a type 2 stool, it's a type 3, type 4, type 5, type 6, type 7. So type 1 is when the children are passing what look like pellets, like, very round, hard, lumpy stools, and they come out in small, small pellets like that. Whereas type 2, the stools are together but very lumpy. It's sausage shaped but very lumpy. Whereas type 3, it is also like sausage, but there are cracks. It's not as lumpy like type 2. Uh, Type 1, type 2, type 3 stools are what we get in children who have constipation. So that is hard, very hard stool, difficult to pass, and all that. Type 4 is what look like a normal smooth sausage or like a snake like stool, and that is normal stool. That stool is taking the shape of the intestine, and that is normal stool. But type 5 is the stool are soft, but is a little bit it comes in small small blobs, like but soft, but not like the pellets of type 1, but it's also not together. And then type 6 is a little bit mushy, like porridge kind and fluffy stuff. And then type 7 is actually the watery, like completely liquid stool, which is what we get in children with diarrhea. So that is um uh type 7 stool. I don't know whether there's anything wrong with my Facebook, because I don't know whether people can see me on Facebook. It seems like I'm not quite sure whether I'm live on Facebook, but I'm live from Easter or from the studio here. But if you're on Facebook and you can see me, just let okay. Yeah, they said there's an issue with Facebook. It seemed like the stream was ended or deleted on Facebook. We'll try. Okay, so I think there's a problem with Facebook. Okay, so I don't know what we can we do. Um, let's just try and see whether we can do something on Facebook Live. Okay, it has ended on Facebook. I'm not quite sure how we're going to get that done. Okay, maybe what I'll do is to go on Facebook Live on my phone. Let me just see what I can do. Oh, sometimes we have technology issues. All right, I'll try and see if I can go live on Facebook on my phone. Okay, but it seems like it's back on Facebook. Okay, it was saying it was live. Okay, let me go on live on Facebook. Okay, all right, let's see. All right, so I need to turn my camera the other way around. Okay, get my camera to be the other way. Okay, all right. All right, let's see. I think I'm live on Facebook now. On my phone on Facebook, and let's see whether I can share that to our groups. Apologies to those on Instagram. We had issues with Facebook, so what I'm going to do now is to share the Facebook. Let me just share Facebook. Okay, yes, wireless connection. Okay. All right. Okay, Facebook. It seemed like StreamYard couldn't connect to, so I'm live on Facebook, and I'm going to just share that now. Okay. All right. I'm just going to share to our groups. Okay. I'm struggling with the sharing. Okay. Okay. Apologies, I'm coming. I just want to get to, to Facebook people to share. Okay. Now let's. Okay, we have it. Come better now. I want to share it. Okay, here post on Facebook. Let us see whether this work. Okay. Okay. I don't know why I'm having difficulty sharing the video. Okay, I can't seem to be able to share it. Okay, I'll send it to share. Okay. Okay, let me just share to the feed first. Okay, sure. Okay, good evening, those of you on Facebook. Feel free to ask your questions. Thank you, Fama, for coming. I think we are having some technical issues today, but let me just make sure let me use my my normal testing. Okay, so let's see whether this will work. Okay, don't know why it's not sharing. Okay, yeah, you guys should just help me share it to the groups because it's just not sharing and I don't know what else to do. So just share it for me if you're able to. Okay, maybe I should copy the link. Okay, I guess that's the best option. Let me go to our groups. Okay, today, not today. Okay, okay. I seem to have a question on Instagram. I'm coming to your question. Sorry, just give me 1 minute today to just sort out these difficulties I'm having. Facebook is becoming a problem now. Okay, okay, okay. Yeah, that's working. All right. Okay. Then let's go to the. There was an error. I don't know. There's something really going wrong today. Okay, it seems like I can't even post something in the groups. I don't know what is the issue with Facebook posting and allowing our videos to go all live. Okay, but for those who can watch, just keep watching for now on Facebook. There was an error. There's something wrong somewhere today, but I can't figure it out, and I can't. I don't know what else to do. I think I've done everything I know how to do. Um, okay, let's see whether it will work. All right, let's just answer the question that Simple Sims is asking. Say, good evening, Doc. My daughter just turned 5, had a road traffic accident in January where she acquired a compound fracture and on her knee and thigh. As a result, she lost so much weight. She's weighing 12 kilos at 5 years and is always having watery stool. She has been placed on Ciprodine. What drug is that? Ciprodine. I'm not quite sure you are spelling that correctly. But let's just say, but it's not helping. She said, or do you mean ciproheptadine, like super appetite, like appetite stimulants? We don't recommend that at all. Please, you should kindly stop that. That is not appropriate for your child to be using at all. Okay. So uh, the compound fracture, how is the fracture now? Did you go to the hospital? Was your child seen by any of the doctors, in the hospital? Can you let us know what the situation is as to that? Is the child now able to walk and all that? So those are the kind of information that we need to know about. So if you are still listening to me, can you give me more information about that? Okay, yes, you say you went to the hospital. Are you saying yes to my cipreptidine part, or you're saying yes to um the going to the hospital? So I want to have more information about whether the fracture is healed and whether the child is now going to the hospital. Okay, I think I'm back on stream here, so I can end this one. Let's end this one. Now let's share this one. Uh, Just share it with my phone because I don't know why this thing is always doing no problem. Okay, so if you can give me more information about that, but I believe your child should be with the doctors in the hospital in terms of the fracture. So if the fracture is healed, then the child should be fine. The fracture is not connected to why the child is having watery stool and all that at all. So um, okay, I think I'm better now with my StreamYard is better. Okay. So that's, yeah, she had surgery and she's still on physiotherapy and she can walk. Okay, lovely. Yeah. So yeah, surgery on the limbs should not cause it shouldn't cause any form of problems unless the child is on medications. And I'm wondering what medication. There's some medication like antibiotics sometimes that if they give, those can cause the child to have a lot of, it can affect the bowel and that can cause them to have chronic diarrhea. So is your child still on like any antibiotics, prolonged use of antibiotics? Because those are the kind of things that will worry us and that may be causing that diarrhea. And so if the wounds has healed and the child is walking, the child does not really need to be on any of those antibiotics. So you may need to stop them completely. And then you need to just give the child a lot of food. Um, Weighing 12 kilo at 5 years is very, very low. The child is actually malnourished. And, the bones are very important part of our uh, body weight. What contributed to our weight, the bone is part of it. So if the child has had fracture, was not walking for a while, not using the legs, number one, that the child will obviously, what we call atrophy of the muscles and all that will set in. So that may explain. So basically, we just need to rehabilitate the child. We need, okay, she's not on any medication, lovely. We need to rehabilitate the child in terms of the nutrition. So this child needs a lot of, and it's not that medication, it's not cipreptidine that your doctor is giving. It is not drugs that we need to give. We actually need to give the child food, and we need to give the child a lot of food. Sometimes we even have to give the child things like amino acid, like things like histamine, something to help the child build up all the muscles that the child has lost and all that. So that's what you need to do. I really want you to, because the weight 12 kilos is the weight of a 2-year-old. So if a 5-year-old is weighing 12 kilos, that is severe kind of malnutrition. So you will have to see a pediatrician, preferably in a teaching hospital, so that they can work out the pediatricians, the nutritionists, they can work out the nutritional rehabilitation. There are what we call supplements that the dietitian can give the child so that the child can get a lot of calories very quickly. So those are the things that we will expect you to do, and those are the things that can help the child in terms of getting back their weight and getting back their rehabilitation. It's not a small process. The fact that the child had surgery, the child was in the hospital for a while, it should have the surgeons, and they should have been working with us, the pediatricians and the dietitian, in terms of the nutritional rehabilitation. But you don't need to worry now that the child is walking. That's good, because the movement of the child will begin to also help the muscles, to come back. The use of the muscle will help them to boost up a little bit more. But more importantly, the child needs to eat. The child needs a high level of calorie intake, and sometimes it's not just eating normal food. We have to give some supplements that will increase the calorie. We need to give amino acids, so something like histamine, something that will help the child to rebuild all the atrophied muscles and all that. So it's a complete rehabilitation work that needs to be done. So I would recommend that you definitely see one of our a pediatrician, preferably in a teaching hospital. The reason why I say teaching hospital is because in teaching hospital, you have all the specialists together, working together. So that is why it is easier for everybody to be on the same place at the same time. and work together. So that is what I'm going to recommend for you to do. So I hope that is helpful. All right. Let me delete this one. Okay. So I think that is helpful. Let me go to Facebook. Okay, good evening. Facebook people are coming live now. Yes, we can see you now. Feel free to ask your questions and I'll try and answer them. Let me just delete some of the posts that were didn't work well. So then, okay, let me delete this one. Okay, I don't. Same still. I hope I've. Okay, you're happy with the question. Yes, I was just going to ask whether you were happy with my question, the answer to your question. So, any other person have a question? Feel free to ask your question and I will try and answer them. I was talking about stools and stool frequency and all that, but I have been distracted. So I because my I wasn't live on Facebook for a while, but I think I'm live on Facebook now. So I'm just going to share the Facebook video properly now and then we'll see how it goes. Okay, this one is still working naturally. Okay, I'll give the correct one to share. Okay, Mercy Sika, good evening. Welcome. Welcome. All right. So if you have any question, feel free to ask your questions. I don't see any question yet. On the minutes, let me also go back. Okay. Okay. Maybe I'll share this here now. Okay. 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 I got a question from Olorun Shola Tenny Caroline. He said, what can I give my child? She has concern. Okay, can you start with the age of the child? Okay, she's 3 years old, 5 months. Always start with the age, not with it at the end, because we always want to see the age right from the beginning. So the child has when it's malaria and cough concerning child's cancer. I don't know if it's because I don't put on underwear for her because she's the type that sweats easily. Okay, it is not because of that. She's not having cancer because of underwear. Cancer cough have to do with respiratory infections. Most of them are due to viruses and they run their course. In other words, they are going to take their time and then it will go. So you can't always fast track it. It's just going to start and it's going to end because most of them are due to viruses and they go on their own. So that is the thing with cancer. So um, um, some children also have what we call allergic kind of rhinitis. So they tend to have sneezing, they tend to have catarrh quite a lot. So that is allergy. It's also a possibility, but it's most if allergy is the cause, and then that means it will have been recurrence on today, off tomorrow, that kind of a thing. So for allergy one, we sometimes have to give them antihistamine for the allergy type, but that this won't be the first time. So allergy is not, it will happen, it will go, then it will happen again. You know, the child is always having runny nose, the child is always sneezing and all that. And for allergy, the most important thing is to know, if you know the trigger, and then you can always avoid the trigger as much as possible. And then, like some children, it's dust, some children, it is when they go through the grass, some children, different things for different children. So, the most important thing is for you to know the trigger and then you try and avoid the trigger as much as possible. So, that is the that is what you can do. But during that phase, sometimes we can give them um antihistamine and all that to kind of relieve it. But if it's just the viral infection kind of cancer, you don't really need to do anything about it because it's going to go by itself. So that's just the what I would like to say about that. So I hope that's helpful. Okay. Okay, she doesn't have it often. Yeah. If she's not having it often, then that means it is just the acute phase, acute respiratory infection, and then you don't really need to do anything about it. You can just leave it. It will run its course. Most of them is just about 2 weeks. After 2 weeks, they will go away. So that's just leave it alone. What was you said you were in the hospital for malaria and cough last week? So when you say treated, how was it treated? What were you given? Because that is also important for us to know. So I hope that is because if you're in the hospital and now your child is sick again, you may actually want to go back to the hospital as well and then see the doctors again and let them know that the child is not yet better. So that's another thing you can do. All right. So let's go back to Instagram. Good evening, my unique kids place. You're welcome. If you have any question, apologies for all the back and forth, but if you have any questions, feel free to ask your question and I will try and answer them. Yes, thank you so much. We are back on Facebook now, so that's working. Okay, I can't see any question on Instagram. Okay, we were just given drugs. Say what drugs now? That's what I mean. I know you were given drugs. What drugs? What are the names of the drugs? I want to know what they were treating your child for. Were they giving you drugs for malaria? Because you also said the child had cough. Or did they think the cough is part of malaria, or did they think the child has respiratory tract infection that is due to bacterial infection? In which case they give you antibiotics. Those are all kind of linked together. I understand that for you as a mom, you just want the child to take drugs and you want to get better. But now your child is still having cancer. So I really want to know what kind of treatment the child had, whether it's kind of related or not. Because if you've been treated with antibiotics and all that, and the child is still having cancer, then it's most likely it's not something bacteria. It is most likely it's just something like viral infection, in which case it's just going to go by itself. Just give it a little bit more time and it will be fine. Okay, but don't have to worry about it. Okay, no question on Instagram for now, so good. No question on Facebook, but I'm happy that Facebook people are here with me now because this was a nightmare. StreamYard failed us today, but we are happy we are back online. So before you all came, I was talking about stools. For those on Instagram, I've given them a little bit of breakdown to say the stool is the end product of digestion. And it starts, digestion starts from the mouth. The mouth is the first part of the digestive system. So whenever you want to ask us question about the stools or poo, you always need to tell us what is coming through the mouth first. We need to know what the child is feeding on. So for babies, you have to tell us whether you're exclusively breastfeeding, whether you are doing formula feeding, or for the 6 months and above, whether you started complementary feeding. And then I was also telling us that apart from that, we also want to know the texture of the stool. That is the second most important information, because a lot of parents worry about the frequency, but frequency becomes an issue only if the child has abnormal stools. But if the child has a normal stool, whether the child passes it 5 times, 10 times, 20 times, is really irrelevant. As long as the stools are normal, we are not going to worry about it. We as pediatricians, we only worry about stools that are abnormal, and then that is when the frequency will be an important one. So if the child is having, for example, diarrhea, watery stool, and the child is passing watery stool 3 times or more in a day, that is classified as diarrhea. That is a diarrhea disease. If the child is having hard stool, so I've shown us the stool charts, but I'm happy to show it again. If the child is having hard stools, and if the child is not passing that stool every day, maybe once in 3 days or once in 5 days or once in a week, then that is constipation. And so that those are the two things that we worry about. So in terms of stool, we worry about the texture, and then frequency become next. Then another thing is that what is inside the stool itself, the constituent, what is inside. So some people we'll talk about, what is that, blood in the stool? Is there mucus in the stool? What is the color of the stool itself? So we talk about greenish stool, brownish stool, yellowish stool. So all those things will also come in as well. So those are the things that we need to know as pediatricians about stools. And but to make life easier, the first and foremost is, how are you feeding a child? So for babies less than 6 months, we always recommend exclusive breastfeeding. Babies on exclusive breastfeeding do not pass stools every day. They actually the frequency of the stool can vary. They can actually pass stools every time you feed them. So immediately you feed them, they're going to pass the stool. Or they may not pass stool even for up to 2 weeks sometimes. So again, that is still normal. So it's a wide variation. But whenever they pass their stools are never hard. I see a lot of mothers telling me, "Oh, my baby's stool is hard," and your baby's on exclusive breastfeeding. It's almost impossible. The stool may be thick, may be pasty, but it won't be hard. Babies on exclusive breastfeeding will not pass hard stools. So when people tell me I'm doing exclusive breastfeeding and my baby's stools are hard, I know you are not telling me the old truths. And I know sometimes parents don't tell us the old truth because they don't want the pediatrician to rebuke them for not doing exclusive breastfeeding. Or people are doing things behind your back, which is also a possibility. So, but babies on exclusive breastfeeding will not pass hard stools. Their stools are usually semi-formed. It's not watery. But there will be a little bit of water with a little bit of solid inside. So it's what we call semi-formed stools. And that is normal for them. So a very popular way to describe it for those of us who are Nigerians is what we call the melon soup or egusi soup. That is how the newborn babies on exclusive breastfeeding for the first 6 months. That's how they still look like. A little bit of all those chalky thick parts and a little bit of water. And usually it's even yellowish as well. It just look exactly like a goosey soup. That is normal stool for babies on exclusive breastfeeding. And but like I said, they may pass it every time you feed them. Because there's what we call gastrocolic reflex. As something goes into your mouth, you suddenly have the urge to go to the toilet. That is actually a normal reflex. It does not mean the stool you're passing that time is the food you are just eating now. Not at all. It just means the stool that has been stored in the rectum, which is the storage for stool before you feel the urge to pass it when it is full. That is the one you are passing out. The one you are just eating is still being digested. It can happen in adults as well, but it's very much more common in children. So they have what we call gastrocolic reflex. It can be excessive. So if your child go to pass stool, immediately they eat. It is not the food they are eating now that they are passing, and it's nothing wrong with that, because a lot of parents worry about that. Is that child is passing out this food the child is eating, so that's why maybe it's not gaining weight. That is not the truth. So that is just a reflex, which is normal, and you don't really need to worry about it. Okay. And so we've talked about babies on exclusive breastfeeding. When do we worry about stools of exclusive breastfeeding? Maybe if there's blood in the stool. Blood in the stool is never normal. Sometimes mucus is normal. Mucus can happen because depending on what you're feeding the baby. For example, those of you who do formula feeding, sometimes your baby can pass mucus in the stool. And sometimes for if you are giving your baby all these multivitamins, so many unnecessary drugs, sometimes they may also pass it out in the stool. So that can also happen. And so we are not worried about mucus so much, but the only time we worry about mucus is when the child is actually passing only the mucus. There is no stool, just mucus or mucus with blood. If you see mucus with blood stools, we worry about the child having what we call intussusception. Intussusception is one of those acute abdomen condition, one of those surgical condition in children. If your child is complaining of abdominal pain, they're crying, and then they start to pass stools that have lots of mucus or blood inside. That is an emergency. That child needs to go to the hospital. Or if a child is passing watery stool with blood, we call that dysentery. So diarrhea with blood is called dysentery. Again, that is also an emergency because that has to be treated properly. Otherwise, we don't expect exclusive breastfed babies to have blood in their stool. We don't expect exclusive breastfed babies to have diarrhea at all. So we don't expect them to pass stool every day. They will pass stool every day. Babies on formula feeding, they tend to have constipation, which is why sometimes you are doing formula feeding, you need to give your baby plain water as well, according to the manufacturer instruction. Okay, Kenny is giving us an update. Say I know it's anti-malaria, cough drugs, and antibiotics. Okay, amoxicillin is an antibiotic. Okay, and then they gave you something like chlorpheniramine, which is pyridine. So pyridine actually will work also for your catarrh if it is something due to allergy. But like I said, if it's viral, it doesn't going to do anything about it. And then the last one is a tablet dissolved in water. I guess that's your anti-malaria for this patient. Okay, so your doctor treated your child with anti-malaria, antibiotics, and pyridine antihistamine, which should be fine. So if your child is still having catarrh with all this, then it means that catarrh is not from allergy. It is most likely viral, and it will resolve by itself. So you don't need to worry about it. And the pyridine, is an antihistamine. It's not really necessary. We also don't tend to encourage cough syrup in babies at this age because we want them to actually cough. We want to know if their breathing is being affected. We don't want anything that would depress their breathing. But it's okay. So I think you just give it time, like in 2 weeks, hopefully it should have resolved. But if in 2 weeks there's no resolution, then you may want to go and see your doctor for follow-up. Okay. So that's what I would say. Okay, so let's just round up what I was saying about stools. I don't have any question on Instagram. In terms of stool, if your child is passing hard stools, infrequent, we worry about it. That is constipation. If your child is passing watery stool multiple times, we worry about it. So I think those are the two things you need to remember. You don't need to memorize formulas, how many times your child is passing stool and all that. You don't need to memorize all that. If your child is passing normal stool, don't worry about it. Whether it's 10 times, 20 times, if you pass stools once a day, you know, maybe once every other day, that is normal. But as long as the stool itself is normal in terms of the texture, let me show you the stool charts again. Apologies for those who are sensitive, wherever. If your child is passing stool type 4, which is a normal sausage snake like stool, smooth stool, long like that, that is normal. It doesn't matter how many times your child is passing it or not passing it, you don't need to worry about it. But if your child is passing stool type 1 to 3 and not passing it frequently, and that is constipation, and we need to do something about that. Or if your child is passing stool type, 6 to 7, if you're actually 7, which is completely watery, and is passing it more than 3 times a day, that is diarrhea. We need to do something about it. Okay. And to round up, what do we do with that? Let me start with diarrhea. Diarrhea is easier to deal with. What do we do with diarrhea? We need to rehydrate the child, because the child who is having diarrhea is losing water, is losing electrolytes. So the most important thing when it comes to diarrhea is rehydration. We need to give the child ORS, oral rehydration solution. That is what we need to do. And you can buy it over the counter. You can make your own. I don't have time to teach us how to make our own, but it's available online. If you Google how to make your own ORS, just salt and sugar. You always have salt and sugar in your house every time. See, we always have salt and sugar, so you don't need to go to the shop. Just mix your. Usually, if you have cube sugar, we say 5 cubes of sugar and a teaspoon of salt. If you don't have cube sugar, 10 tablespoons of sugar and 1 teaspoon. The salt is always the small one, so 1 teaspoon of salt. And then you mix it in about 600 ml of water. That is salt sugar solution. But if you have the sachet ORS, just tear it, pour it in 1 liter of clean boiled cold water and mix it. And that will give you the oral rehydration solution, and that is what you need to give your child. Just encourage your child to keep drinking. Why don't we just say give ordinary water? Because ordinary water will give water, but it doesn't give the salts, the electrolytes that the child is losing, and that those electrolytes are quite important for the child. It's not enough for you to replace the water. You need to replace the electrolyte, because those electrolytes, if they are low in the body, they can lead to the child having other complications, like the tummy will start getting distended from, especially if the potassium is low. Low potassium can actually stop the heart. Low sodium too can cause seizures. So many things can happen. So that is why it's important to rehydrate the child properly, and not just with ordinary water, but with all the electrolytes, so ORS. And then you can give oral zinc. Oral zinc is not a treatment for diarrhea. It's just it heals. It's not like something that will stop diarrhea. That's what I'm saying. But it heals the intestinal lining of the digestive tract. So, and it will make the duration of diarrhea to be shorter, and it will also prevent future diarrhea and also prevent future pneumonia. So we always want you to give zinc to the child. Then the next one is, if your child is having hard stool, constipation, you need to give the child a lot of water. Drink water. Children sometimes don't remember to drink water. We need to remind them, let them drink a lot of water, and then let them also eat a lot of fiber. So especially vegetables, that is where they can easily get the fiber, because that will help them to move the bowel. But just so that if a child is already constipated, that child has to be treated. The constipation itself has to be treated. And so we have what we call laxatives or stool softeners. Stool softeners and laxatives, they will help us to for let out the hard stools that are there. You have to let out what is inside already before you can talk about the deal with prevention of future episodes. So you need to give laxative. Unfortunately, constipation always has to be treated. So we have different kind of laxative. There's liquid paraffin, but that's very messy and oily. Most people don't like it. But we have things like lactulose. We have things like the Movicol, Laxido. There are lots of all these laxatives that your doctors can prescribe for you to get out all those abscesses. And for some children, it's so bad that we even have to give them suppositories of the laxative so that the stools can come out. And because sometimes when the stools are so hard, the child can actually tear the anus. The skin around the anus can tear, and the child will have bleeding. So it's very important that constipation is dealt with. But after dealing with the constipation, we now need to prevent future episodes by making sure we give the child water, we give the child lots of fiber, fruits, vegetables. They are very rich in fiber, and so it will prevent constipation. We should avoid too much of all these pastries and all those things for our children. They don't have a lot of fiber, and they make the children constipated. So instead of giving them all that, give them the bananas, give them, carrots, give them peas, give them vegetables to eat. That is actually much, much better to prevent constipation. But once the child is constipated, we need to treat it with laxatives. Sometimes we need to give them suppository of the laxatives. Sometimes we need to do what we call fecal impaction, like we have to physically go and remove the stools from the intestine. And because usually children are always having abdominal pain, it's really very bad sometimes. So we have to really do this impaction, like removing the stools. So those are the things we need to know about stools. So I've talked about normal stools, and I told you it doesn't matter the frequency. And I've talked about hard stool type 1 to type 3. That's if it is infrequent, that is constipation, and we have to treat it. But more importantly, prevention. Children should drink lots of water, up to 4 to 6 glasses of water a day. Sometimes you need to measure out the water for them and make sure they are drinking their water in the bottles. They are not just pouring it out. Let them eat a lot of fruits and veggies. We talk about your 5 a day. They should have that. Those are the things that will help them. And let them eat a lot of vegetables and soup that have vegetables. And then we have if the child is passing watery stool, type 7 stool, and more than 3 times a day, that is diarrhea, and diarrhea can be treated with ORS and oral zinc. If there's blood in the stool, it is never normal for a child to have blood in the stool. Any child with blood in the stool, you have to come and see us. Especially if it is watery stool with blood, that is dysentery. If it is hard stool with blood, most likely is the fact that the child has the hard stool has caused the skin around the anus area to tear. So there's an anal tear, there's bleeding from that area. So that can easily be treated, but the most important thing is to treat the constipation, and the wound will heal by itself. But if there's blood in watery stool, or your baby stools are looking black, and you're not giving them iron supplements, then you should see us, because dysentery is an infection, usually bacterial infection, and we have to give the child antibiotics. That is the only time when we always want to treat children with antibiotics. If they have bacteria dysentery, we have to treat them, or if they have cholera as well, we have to treat them. Yeah, Deborah is asking that what about mucus? If it's just mucus in the stool, we don't tend to worry so much about mucus, except the mucus is mixed with blood. Mucus, there are many things, because mucus is basically the lining of the intestine being shed into the stool. That is mucus. So sometimes it could be the drugs you're giving the child, it could be some other things. So if the mucus is not continuous like that, I won't worry about it. But if there's mucus mixed with blood, or mucus only, like the child is passing mucus only with blood, or mucus only alone, I will worry about it. We tend to have that in children with problem in the intestine, and usually most of those things don't tend to happen alone. If it's happening with severe abdominal pain and all that, then we worry that this child may have what we call acute abdomen, something that require operation. The most common one is what in children is intussusception. Intussusception is when some layers of the intestine has gone into another layer of the intestine, and it's caused a lot of pain for children. There's blood, they are passing frank mucus mixed with blood. This is an emergency. The child needs to be taken to hospital. We have to reduce the intussusception, and we treat the child. Greenish stools, I don't have much time to talk about greenish stools. Greenish stools can be due to inadequate feeding, especially if it is watery, scanty greenish stool. That can be the cause of that, or it can also be some food we eat. The pigments can get into the stool. So if the child is normal soup, but a little bit of green. I don't know about it. It's most likely could be the vegetables or some drugs or something, some milk too. If they put iron inside, can give the baby a stool greenish tinge or greenish color. But if it is watery stool and it's greenish or it's scanty, it's most likely inadequate feeding, what we call starvation stool. And for starvation stool, you just need to feed the child more frequently. So, and I've talked about blood in the stool. So those are the time we need to worry about. So, all right. So thank you so much. If you still have any question, remember you can go to, or if you are just joining us last minute, welcome. But you can go to our Facebook group and you can ask your questions there, and we'll try and answer your questions as soon as possible. Apologies again for all the back and forth with our Facebook streaming today. Well, I'm happy that we eventually got over it. Technology sometimes can be difficult, but feel free to still post your questions on our Facebook group. I'm going to be going out. Next time I'll see you, it will be July, and it is HCP month in July. So watch out for all our programs. And if you have any question, again, like I said, you can post it on our Facebook group. If you have any topic you'd like us to talk about, feel free to post it on our group or just send us a message on our DM, our inbox, or our email activations@gmail.com, and then we will try and talk about that particular topic in our future episodes. So thank you so much, everyone, and have a wonderful rest of your day. And it is bye from me. Bye bye. Daniel, Shemilore. Shemilore, bring the broom. Let's start from me.